Good afternoon. Good afternoon. All right, please, I want to welcome us to this our today's class, and I wanted us to just go, but we just started, and we need to really cover a lot before you go for your Christmas break. So it's not just about the missed exam, but about us covering a lot. Other departments they've gone far. So I wanted you to just go home and study, but I remember that we just had how many classes once, right? We may not have our quiz today because of their this semester exam. I'll just do normal lecture. So the this semester exam will serve as the first quiz, okay? Yes. Then when you come back, then I will look for a way to fix those ones. Are we together? But I think the most important thing now is for us to start to do our lectures. So, all right. I saw somebody here on the board doing something, and I shaked him. He started acting weird. I'm not against what you are doing. Okay. In fact, I like it. It shows that people are serious. Am I communicating? It's a good thing, not just for the purpose of missed exam coming up. When there's no lecture in your class, someone can just come out and revise whatever you must have done in class. It also helps those that join newly or those that miss the class to follow up. Am I communicating? It's a good thing. Eh? That's why I call you prof. I like that. It's okay. I was just pulling your leg. I was just pulling your leg. And so I'll start from where we stopped in our last class. Where did we stop? Where? We are done with branches of psychology, right? Are we done with that?
Yes. Psychology.
Yes. Okay. Today is psychology, right? Is it psychology or PhD? Psychology, yeah. Are we done with branches of psychology? Are we? I don't think. Are we? I think we are done with branches of psychology. Good. So we are discussing relevance of psychology in what? Health. And I started with I gave you I told you about promoting health, right? Health what? Healthy behavior, right? Yes. Promoting healthy what? Behaviors. So we discussed how you can apply psychology in what? Promoting healthy what? So who can tell us what we discussed about how you can apply psychology in promoting healthy behavior? Who can tell us? We were all in a class that day, so who can tell us how we can apply psychology in promoting healthy what? Behavior. I'm all ears. Oh yeah. Who will tell us? Those are here. Tell us. No, how we can apply psychology. We are discussing the relevance of psychology in health, and we have actually discussed one of them, promoting healthy what? Behavior. So my question is now, what is the relevance of psychology in promoting healthy behavior? So how we can apply the knowledge of psychology in helping our the people we are training on health education to promote their healthy behavior. So how can we do that?
So we can actually do that by studying the rituals and behaviors.
By doing what?
Studying the relationship between the brain and behaviors of individuals. Like how people think, react, and behave.
Who else? Who else? Who else? Tell us. Oh, what's your name? Ebony, what's your name?
Yes.
Jessica, tell us.
Okay, you can like point them to for them to like participate for regular exercise and good diet.
What theory did I say you can use here?
Promoting
The theory I mentioned. Trans what? Trans what? I mean model, sorry, not trans what? Critical model, right? Did anybody bother to find out what trans theoretical model is all about? Did anybody bother to find out? Anytime a word you are not conversant with is mentioned, the first step is to on your own try to find out what it is. So did anyone try to find out what trans theoretical model is? Okay, you did, but you forgot. You didn't write it down somewhere. We if you search it with your phone, it will still be in your history. Bring it up. Basically, what happened? That this model talks about. You see, once somebody, there are different stages of behavioral change. There are different stages of behavioral change. So that's what this trans theoretical model outline these different stages of behavioral change. Did you find us? Did you come across something like that? Eh? Now, knowledge of psychology will help you to understand these different stages of what behavior change, and now know how to adapt it in trying to make them to change their way of what life in terms of their exercise, their lifestyle in general, their dieting, and other things that has to do with your what behavior. Is the understanding of this trans theoretical model of different stages of behavioral what change. Oh yeah, what did you see?
Describe the process of change that people can go through to modify their problem.
You say what? It defines what?
It describes the process of change that individuals go through to modify their problem
Okay.
behaviors such
Okay.
as smoking, unhealthy eating, or physical
Okay.
inactivity.
Okay. Is that all?
Yes, in the stages of
Okay. Okay. Those outline. Just outline them. Those stages. What are they?
stages of change like pre-contemplation.
Pre-contemplation.
Yes.
Yeah, the person is still thinking. Do I? What's that? Okay. Want to see me? What have in class? So they send me to one. We are at the middle of study before I was distracted.
Yes. And pre-contemplation.
Second stage is what?
Process of change, that's the cognitive, effective, and behavioral strategy.
You talk about pre stage now. What is it? Contemplation what? Stage. Next one is what?
Preparation.
Preparation stage. Next one is what?
Action.
Action. Next one is what?
Maintenance.
Maintenance, right? Last one is what? Termination. Good. Anyway, what I want you to understand that this knowledge of knowing that people change their behavior, different stages. It's just normal thing you do. Maybe if you want to, if you maybe there's a particular habit you have and you want to change it. It's not what you just wake up one day and then do what change. I'm not committing. It's step by what step. Is that you pass through these steps without even knowing. First, you start thinking about it. Now, this my lifestyle. Am I sure it's not bad for me? Two of us. You must have it. You must sit down and think about it first before you now start pointing out areas where reason why it's not good and reason why you should continue. If reason why you should continue is more than reason why you should stop with that behavior, you go back to that again. Three of us, even if they preach to you from now till tomorrow, you still go back until you see reason for quitting it. Maybe something serious happened to you. You start thinking, nah, I think I should do something about this. So, and sometimes you may even jump each of the steps depending on what is making you to change that behavior. Am I communicating? So with the understanding of these steps, these stages of the behavioral change, psychologists now that knowledge to know what guide people in changing their style to shift to healthy what but promote their what health style like smoking. What's that? I can't access it now. See, I can't. Are we together? All right. So now the next thing is preventing what illnesses. Preventing illnesses.
Also, I will stop at that relevance of psychology in it. I'm not doing it.
In where?
Relevance of psychology.
You said we stop here. Sorry. We are done with promoting healthy behaviors, right?
Yes.
So the second one is preventing what illnesses. Good. So how do you think psychology can? Do you think psychology has a role to play in preventing illnesses? Let's just share what you think before I go to what we have. Do you think psychology has a role to play in preventing what illness? Oga, what do you think? So tell us. Oga Frank, oh yeah, tell us. Tell us what you think.
Well, someone's state of mind
Okay.
can really affect someone's health because most people try your mental health.
Okay.
Because if you are the kind of person that used to think too much,
Okay.
can cause stress. People that are thinking too much can affect their health. And for people who doesn't have straight mindset, usually their eyes always scattered and stuff, can start having problems with their health.
I think the question says what is the relevance of psychology in preventing illness? Can you smoothen the answer well? So it can fit into the question.
Um,
You have the idea, but I want you to structure it well.
Psychology most of the time can be used to stop people from addiction, those drug addicts and stuff. They use psychology
Okay.
in Because most people, once they have been addicted to something, like something that they mostly see through what doctors do.
Like it gave within their mind. Yes. So it's whatever their mind tells them,
Mm.
they initially accept. But if in terms of being sick
Mhm.
mentally or normal illness, they cannot even decide on whether they are sick or not because their mind is already at this stage very affecting them.
Okay.
Meanwhile, it's not affecting them. It's just
Okay.
their mindset.
Okay.
And psychology comes in and
Any other thank you. Any other idea? One more person, then we move on. Sorry. Dan, Dan, what do you think? What do you think?
Relevance and psychology.
Uh-huh.
Relevance and psychology is what I say
In preventing illnesses.
in preventing illness.
Okay, thank you, thank you. Now listen. You know stress, eh? Stress is implicated in a lot of illnesses, especially chronic illnesses. You see, stress is very bad. You won't even know. You won't even know. It's implicated in a lot of chronic illnesses, ranging from cardiovascular diseases down to diabetes. A lot of them, chronic illnesses, stress, even ulcer. Am I communicating? Am I communicating? So, with the knowledge of psychology, that's why, in fact, that's why you are doing psychology, because it will help you to know how to handle your what client or your patient. Am I communicating? Now, if you're able to manage, help the your patient or client, as the case may be able to manage their stress. In our last class, I spoke to us about stress and how it can lead to mental health and other issues that can affect your what health. So if you're able to help your clients manage their what stress, you will actually help them to prevent development of what major chronic what diseases. Am I communicating? Major chronic diseases. Like now, I gave you instance of a patient that maybe I gave you instance of maybe somebody that is always putting his or her eyes in what he should just overlook. Am I communicating? You see yourself stressing yourself unnecessarily emotionally on things that you can't control them. It's not you that will control it. Maybe I use a cheating partner as example, right? Right? You can't. It's not you. It's not you that made the person to stop by stressing yourself. It's not you. What will make the person to stop? We hit the person one day. He or she will do what? Stop. Not you. So by the time you are there stressing yourself emotionally, your mental health is not what stable. You may end up someone that has no cardiovascular issues. You start developing what cardiovascular what diseases. You be ask yourself where is this one coming from? Am I communicating? So now, if let's assume now somebody with a knowledge of psychology, somebody comes to you and from your discussion you try to find out what and what about the family, and maybe the person will drop one or two, maybe the person may say alpha, what of your husband now, how are you doing, the person may just, even the facial expression alone, even the person's facial expression when you mention the husband or the wife will tell you a lot that something is not what right. Even though it is private, but it's holistic. Health is what holistic. Remember, this is health promotion and prevention. It's not just about medical treatment. It's not just about what medical treatment. They have not become patients. Am I communicating? Hoping that there's a difference between client and what? Patient. They have not become what? Patient. So from that interactions, you may even start you may even start asking one or two questions. And from there, you may help the person to see the need for the person to not to allow him or herself to be in such unnecessary what? Stress. You may not know what you have prevented the person from developing in the near future. Just that interaction alone will help the person to know that, man, I need to take care of myself. Remember self-care. Remember what? Self-care. I need to take care of my mental health, so I don't develop what I don't even know where is coming from. Am I committing? You have any of helping the patient to do what? Prevent what? Such illnesses. Especially like this chronic illness, and you will know when they're developing. You will know. You will know when they're developing. I use myself as an example. My BP, even till now, my BP has always been below 180. Sorry, 128. Highest is 128 at this my age. But there was time I passed through, I call it unnecessary stress, which I shouldn't have, put in my head. I noticed that my I was having headache always. My heart was always, I was like, what's going on? Let me go and check my BP. I checked my BP. My BP was around 130, 138, 138, 90. I was like, me from ages, my BP has always been highest 128. Nobody told me to remove your mind from that nonsense. Am I concrete? Nobody advised me. The person I showed my, she said, go and take the drug. And I said, no, I'm not taking any drug, because personally, I was aware of where the thing came from. At that spot, I removed my mind from it. I stopped bothering myself about that thing. What I was doing, I was checking it every day, because you cannot use you cannot use one check of your what BP to conclude that you have what high blood pressure. Am I competing? At least you should do it up to 3 times in different occasions. So I kept checking it. For the phone, I removed my mind from that, and I checked it for about 4 days. It came down to 120, sometimes 120, 117, 118. Am I communicating? Have you been I did not? Had it been I did not consider all those things, and I was busy stressing myself, maybe by now I would have developed what? High blood pressure. Am I communicating? So that is very important. We know this, and it help us to be able to guide our clients properly. Are we together? So it's actually the knowledge of psychology actually plays a vital role in preventing illnesses like cardiovascular diseases, diabetes, obesity. Of course now you don't need that obesity. Even eating habit, hope you know, we have discussed it about in promoting health. If you promote health, what are you doing? You are preventing disease. True of us. If you promote health, you are preventing diseases. Am I communicating? So and all those ones you will do in promoting healthy behaviors, you are at the same time doing preventing diseases generally. So health psychologists use cognitive behavioral intervention to help individuals manage stress, because stress is a significant risk factor for many chronic diseases. I've said that before now. So the next one is improving treatment outcomes. Improving treatment outcomes. So after maybe the person could not prevent the disease from coming, the illness from coming in, maybe before you come in contact with the person has already developed that particular disease. You can also help the person. Are you aware? You can also help what? The person. You can also help what? The person. So can someone give us an idea? Or you say something? Tell us something. How do you think psychology will help in improving treatment outcomes? Let us share that in your head. Don't bother the question. Just hear what you think. I want to hear what you think. It's not what I say, what you think. So how do you think psychology can help to, improve what? Treatment what? Outcome. Oh yeah. Silence everywhere. Is that what? You don't have anything anything to say. Please, in my class, so you must have something to say. Oh. Because we have brain, three of us. Yes. We have brain. So, and we'll be talking about psychology. You must not say it the way it is. I want to hear your own words, what you think, not what they said, what you think. So, what do you think? Tell us. No idea, too. Who can tell us? Who can share with us what you think? The role, what you think psychology can do to ensure that treatment outcome is improved. I'm waiting. Who will save us?
By counseling,
By what?
by counseling,
Counseling. Okay.
by counseling,
Uh-huh.
and generally can also help improving treatments. Like some people that they are not mentally stable, or maybe they are depressed, or due to one of them, just like what you said, that you said your BP was normal before, but
Okay.
due to one of the things you put in your mind, your BP push up to 130 something over 90, and it's unusual. But because you are a psychologist, you know that you're supposed to remove that thing from your mind.
Okay.
So, like if we have a patient, or it's part of like promoting health. Maybe you are talking to people and counseling them.
Okay.
Maybe you can let them know that whatever you have in mind, or whatever the problem is, you counsel them so that they will remove it from their mind. And when that happens, the treatment they are being given, it will be improving.
I like that. I like that. Someone is thinking. Someone is thinking. I like that. Any other idea? My friend, you have to tell me.
Sir.
Ma, we are listening. Oh,
I
yeah.
don't hear.
You were here, but you're not here. Ma, welcome back. Oh, she need to hear the questions. But she was here looking at me. How did it?
Question is
Hey!
improving treatment
If
outcome.
you like throw away your face, I'm coming to your desk.
Someone's going to improve.
How do you think psychology will help in improving treatment outcome? Mm-hmm. Uh-huh. No other idea. Where are you going to? You think I'm coming to your desk? Okay. All right. Okay. Oh yeah. Tell us. Okay. I thought you raised your hand. Tell us now.
Now, when I started,
Uh-huh. After that, what next?
like,
I'm coming. Behavior. You now do what again? You were about to say something.
Coaching the individuals,
Huh?
coaching the individuals, pertaining their hygiene, and
Okay. Uh-huh. Wait. Talk now.
As a psychologist,
Uh-huh.
you can help your patient by managing their stress, by letting them know what they are doing and how they should go about it, what they are supposed to do.
Okay. We're bringing in psychological intervention
Okay.
in the course of treatment. There are other drugs that are responsible for gaining such outcome. In the course of the treatment, maybe if it's a very, for example, the COVID-19, for people who were infected with it, there are a lot of people. Fortunately, unfortunately, they would have passed through depression, and this will cause more backdown in their health. So, antidepressants can be offered to them to help reduce the stress of depression on their mind, and reassuring them verbally. We can also make them hope that they get well.
Okay, let's summarize. Let's summarize. I have point are coming out now. How what happened? What happened?
You are thinking, so
Okay, you're thinking that's good. I like that. I like you. Okay, okay. Nice one. You're taking now. Good one. Oh yeah.
by helping individuals to cope with their chronic disease.
See, another problem. Do you know one issue with these chronic illnesses? They tend to give up. Depression setting. Greater percentage tend to give up. Give up on life. Is it was it in this class I okay, not in this class. I was when I was working in hospital. I was in the ART clinic, heart to heart. You know, one patient, in fact, she nearly died. In fact, she had already given up. Uh, so to say this, but I have to say it. Look as if they abandoned her. I just looked at her. Because of that person, I was going home after 7. Almost every clinic day. I was going home after 7. Sometimes before I get to my house, 8 o'clock. Then if I do after, well, I do mainly afternoon shift. From 2 I start. Highest 2 to 7, 2 to 6 or so, I'm done. Am I communicating? Now, I told myself, I won't allow this lady to die. That's what I told myself, that I won't allow her. She had already given up. So that is a very serious problem. To cope with what the illness is another level. It's not about pumping drugs in the system. It's about the person coping with. But this is what they will do it for years. Sometimes if you give them the message, they won't even take. Or they take it anyhow because there are cases you see them crying. Let me die. I just want to die. As in, they start begging death to come. Huh? Therapy like. That's where psychology comes in now. That's where psychology now comes in. Do you not understand it now? What are you to therapy if you don't have some sound knowledge of what psychology? There are nothing to therapy about. True of us. That's where psychology comes in. It's not about the drug that you are giving them. It's about the state of their mind. It matters a lot. Am I communicating? So psychology is vital in improving health what outcome. Some people had already given up before they died. So in fact, some people already died before they finally died. Only in their mind they are dead, and they have accepted it that they are dead. And that thing you are doing, you are just wasting your time. Communicating? But if you are able to speak to their mindset and they tell themselves, "I'm not going to die." First of all, they will tell themselves, I will not die. They will believe on their own that they will not even die. That's when any other medical intervention you are giving will work. That's when it will work. And now that's when they will see the need for them to even listen to what they're telling them about changing whatever they need to change. Am I communicating? So psychology is what? Is vital. That's why you are doing it. Are we together? So psychology is essential in improving treatment outcomes of various health conditions such as cancer, and also chronic diseases and terminal illnesses. Very important. Even before they finally die, they were already what? Dead. Cancer, HIV/AIDS, chronic pain, and what have you. So health psychologists use evidence-based interventions such as cognitive behavioral therapy to help individuals cope with what? Health illnesses and improve their quality of what? Life. And improve their what? Quality of what? Are you with us in this class? Yes. Are you sure? Okay. Their quality of what? Life. The next one is pain management. The next one is what? Pain management. Pain as in pain. So, Auntie, share with us. What do you think? How do you think knowledge of psychology will help us in pain management? So, it's not about, Mama, have you taken your pain relief? Maybe Mama is having arthritis or serious chronic pain. Have you taken? It's not about taking the drug for pain. So what else do you think what role do you think psychology can play in order to help to manage pain? We are listening. Hope you are listening. I have to tell us. No, stay. I'm coming to you. Yeah. Be thinking with you to tell us what you think. As in pain is pain, whatever pain. You can use any sort of pain to give. Yeah. By telling them to take their drug, pain relief. I will tell you, I'm tired of this. I'm tired of this pain relief. I'm tired of this drug. I'm tired. I can't take it again. I'm tired. Every day, I'm taking this and I'm tired. So what are you going to do? Let her finish. Start. No idea. Are you serious? I am. What do you think? Okay, so you can go. Okay, please, you were rapping for us before. Continue rapping.
I said, like, you can educate the patient.
Okay.
You understand? By just letting them feel comfortable and let them know probably the drugs, the reason for taking the drugs. Just educate them more on it so that they can feel relieved.
Okay. Any other idea?
Yeah.
Wow. Talk.
Let answer.
No, it's not true. You, talk.
Okay, like emotional pain, most times.
Emotional pain.
Like heartbreak.
She said emotional pain.
Yes, heartbreak.
Heartbreak. Tell us more about it.
Like if you talk to somebody about it, it might help and reduce the pain. A word of encouragement and yes.
Has any of us felt that type of pain before?
Yes, yes, now from experience. Oh my God,
Coming.
that is the worst pain ever.
I hope you came out of it.
As in, wait now. Wait. As in, you felt that pain.
Sir, the pain, the pain.
Wow.
Very strong. Sometimes you even isolate yourself. Yes.
Some people take other people because of it.
Yes. You have to talk to.
She's speaking from experience.
From experience.
Did you consult a therapist before you could take care of it?
Talk to my friend.
Did you?
My friends are the therapists.
Okay, your friends. It's well. Tell us.
Pain management.
Okay.
At times, it can affect someone as a behavioral change because of the state of mind and depend on the particular pain the person is having at that moment. I have a friend.
Hey, sorry,
I have
second.
a
You can't
male
listen.
friend. He had accidents twice.
Okay.
The first one is not much more like that, brutal like that. But the second one, this particular bone break.
Okay.
But he did not know. He went to call Malam. They were like massaging the leg and put stick and bandage it. So when I saw his pains, I was like, and I advised him. The way they are massaging this leg every day, did you do x-ray? Did the Malam see the bone that break before he started putting stick and bandage it? I have to educate him that if you don't want the situation whereby your leg will be amputated, you'll be using 1.5 leg. It's better you go through normal procedure. And he listened to me. When he went to do the x-ray, in fact, that is when we detect that is this bone that break into two. It's not something Mala can do. So we now refer him to Bobi. From Bobi, they now said they have to deposit 1.5 million naira. Wow. With 2 pints of blood. That is when he knows he is joking with his leg then. Because he did not know that it is as fatal as that. It's just not something that Malam can do. Exactly. They were now running up and down for money from one place to another.
In that process, my sister.
Yeah, so where I came in
Carry your book and come.
is state of mind.
To help people identify and change their negative thoughts. I can use that, right?
Okay, it's okay. Thank you very much. Any other idea? Let's hear you.
So, how I can relate to it is in the course of pain management, I had this recent experience. No, not recent actually, but okay, the pulse was rising out. I was just feeling pain in my chest due to some reason, some severe thoughts I carried. So this particular person met me and came to my aid. She did not offer me drugs. What she did was she checked my BP. She gave me a bottle of water. She rendered physical contact, hugs, and stuff, cleaning my chest. So all of that cleared the pain in my chest instantly. So I don't know how to say it.
Okay. Or maybe it's two of you are maybe in the same level.
No, not the same level. I've not.
No, you may not be exactly the same level.
I've not been in love before.
No, you may not be exactly that.
I've not been in love.
I'm coming now. That's negative.
Then they pay you to see
Okay, yes. See, hello. See, I'm training you to think. You must not. It's not a stereotype thing that this must be the way you must put it. I want to let's have the understanding. Then, what's that?
Like this, for example, correct? How you want to say
Uh-huh.
what size is low?
Let's hear you. Let's hear you. Yes. There's one movie I watched. Thank you. There's one movie I watched. So okay. Talk. Let's hear from then I am.
In pain, there are levels of pain. We can rate pain from 0 to 10.
Hello.
Usually,
Listen, someone is talking. You say what?
I say in pain management or
Okay.
someone having pain, we can range pain, the level of pain, or to scale it from 0 to 10, depending the level of pain the person may have.
Okay.
So in how to manage pain, depending on the rate or the scale we take, it can be through exercise, that's one. Maybe if it is emotional pain, maybe you can manage the pain, maybe through music, something that will drive away
Dissuade your mind from it.
mind from it. Then depression or emotional, and also if it is
Hello, can you listen?
if it is in joint like accidents like you said, maybe it might already been addressed, see an orthopedic. So exercise can also help in managing that pain.
Okay. And it can also, it can also be the one that is even more serious is chronic pain.
That's what you don't want to say. You don't have to talk to
Okay, I thought. Sorry, I thought.
you don't allow me to talk.
I thought. I'm allowed. I thought. You don't vex. No vex. No vex. Tell us.
Like by helping individuals to manage their chronic pain, that's what I want.
Okay. We are saying okay.
Yeah.
Sorry. You know, we are just wanted to add to what you've been saying. The issue is you see that chronic one. That is why you need consistent because a lot of things are involved. Am I complicating? So that chronic. My God, have you seen a patient?
I have a patient in our team. We have 5 kids. We found out that 5 kids is not for you.
This lady, she really hates breakfast. Now, a therapist is very, very important at this level now. A therapist is very, very important at this level.
What is you get you one therapy.
Are we together? Hello? Are we together? Are we together? One house, please. One house, please.
5 years for relationship.
Have you come? Wait. After you come and tell me who did that thing. After come and tell me. We need. I need to hold a serious session with you. Hello. Now, have you who among you have been with a patient with serious chronic pain? What is chronic pain? What is that by chronic pain? It's not severe. It's not about severe. A pain can be acute and severe. Acute and chronic. This pain it has been there. It keep going. So it's not that it will come. You take drug, it will go. The chronic one build up over time and it's with the patient. It's not that the person has pain. You take and get sick, it will go. Those people that have what is it called? Arthritis, serious ones. They have chronic pain. They have chronic pain that is there with them. So far, that thing is still there. Is there with them. They are there. They need serious therapy. It's not easy. Am I competing? Then those with have you seen who among you have been with cancer patients? Don't pull our camera down. In fact, don't match this thing. Stay there. Then sickle cell anemia patients. The pain goes mental self. Are we together? So, hello, one house. Huh? See, if you wake up, see as you get so now, your body is you're okay. Now you win. Some here thinking about money they don't have. And when they are thinking about money, they do not develop another thing again. They will start suffering for that one. Money you don't have. Then you have developed another issue. No money to treat that issue. You have developed. It got double issue for you. If you are healthy, now you win first. Then you ask God for the other one. If you are there and thinking of how to, you develop serious issue for yourself. Am I communicating? So psychology is essential. Sorry. You can feel me. So psychology.
It's emotional.
What is dealing with our ladies now is emotional pain. They don't carry their heart. Go give one useless human being. Don't put my camera down. Hello. Look at you. So, it's painful too. Yes. Especially, we have diabetic neuropathy too. Yes. That one is also there.
There's something I was watching on Instagram that the boyfriend poured, not even boyfriend, husband poured acid on the girl.
Okay.
She didn't do anything according to the storyline. Because the guy was like, the girl is too beautiful, the guys are disturbing her. You have to pour acid on her.
Mental issue.
So what is that pain is called what?
Pain. You mean whose pain? I thought of or the guy?
No, on the girl.
You know that thing is burnt. Hope you know.
Yes.
Yes.
And that guy cannot even get the guy
crying. They say he's feeling pain. He's feeling physical pain and
Emotional pain. I'm right.
Yes, yes. No, neuropathy now, it has to,
How to manage it?
how to manage
Some bad days.
Oh, yeah, we have someone in the hospital. The doctors, they are even confused on how to manage the patient. Like, they are saying they want to refer the patient probably week or last week. So,
there are, basically they must have given the drugs that's available.
yeah,
All these, I don't know what they have done. Whether they have, maybe most times they will start with all these big this thing. Maybe Neurobion or
yeah.
Meta B, all those things. They may start with that one. Some may even go to the extent of using all this drug. What is it called again? Else, God bless you. So may go to that extent. I'm not completely, but most times you may think, what are they? What you cannot just say neuropathic pain. There are a lot of things. Is it diabetics? Neuropathy? A lot are involved. I'm not complicating. So it's not what I can just stand here and say this is what person should use. It's what should properly cracked, know exactly what is surrounding that. Okay, because like someone that developed diabetic neuropathy now, you first of all know that there's a diabetic background. You know exactly what you are treating, and what is the main issue, and what is it called, adjunct to what treatment. Am I communicating? Are we together? Sorry, here this class is not for drugs. Hope you know. Hope you know. But I just mentioned so that you. Now, are we together? What's that? Question.
I have a question.
I
I
ask.
have a question. So please, since a psychologist have like you can't hear you. I mean, since the psychologist have access to maybe when it comes to management of the mental health. Okay, I want to ask, can the psychologist also work?
Where does clinical psychologists work? They can work there now. They can. They can. Clinical psychologists, they can. Am I correct? They can. It's clinical now. It's not just about health psychology. It's purely clinical now. Here now, disease has entered. Hope you know that prevention is different from curing. When you talk about curing now, you're talking about clinical. Am I competing? Health psychologists is just to promote healthy behavior that will help to prevent that from coming. But once it has happened, clinically, now you have to go and spend. Once you talk of treatment now, you're going to what? Clinical. That's why we have doctors and we have public health workers or community health workers. I'm not communicating. They're not the same thing with a physician that is there. A physician that is there is waiting for you to come for already established issue to treat it. But at the level of trying to prevent, most of the things you do here is preventive what? Measures. True of us. That's why we talk of health education, to promote health. Once you have healthy lifestyle, then even doing treatment, you also have role to play in helping the patient to have a better what? Outcome. Treatment what? Outcome. By as they are doing or undergoing that treatment, they also know how to help themselves in order to be able to get good quality of what? Life after the what? Treatment, by adjusting to what led to that. Something led to that. So whatever you are telling the patient already on treatment is to prevent what led to that issue. Because if they don't know, well, even if they are done from that, they will ignorantly enter it it again. It happens. Am I communicating? So psychology plays a critical role in pain management. Health psychologists use cognitive behavioral intervention to help individuals manage chronic pain, reduce related pain disabilities, and improve their overall quality of what life. Related pain disabilities, most of the times e go towards mental what health. Am I communicating? It's very important. Now let's look at health disparities. What do you understand by the term health disparities? What do you understand by the term health disparities?
Differences.
Difference in health what outcomes. Any idea? Huh? Huh? Okay, now this one is clear. This one is clear. Have you heard of cultural sensitivity? That whatever you are, it's not the way you treat people here in this particular culture that you treat in other culture. Hope you know. So if you are aware of these health disparities, you will know what measures to take in order to still get the required outcome, even though you not follow the same what procedure, but you still get the required what outcome. You not say, because like now there are some places you may go, you cannot inject them. Are you aware? Are you aware? It depends. If need arises, now you can. If need arises, you can. Don't watch film. They just gather them before they just hold them. Boom. They do that.
Even though I was even like wanting to ask, if the psychiatric patient bites, so does it have does it have an effect on that person? Like when a dog bites, like when a dog bites.
What dog? You say what? You what? Give me what? So, in a nutshell, if a mad person bites someone, the person will run mad. Is that what you mean? But what? Now you understand what I mean?
Some people are also finding it when the mad person bites you. Even though if the dog bites you, step back.
See, when somebody bites you, when a dog bites you, what it causes is you want the dog. There's something the dog deposited. So okay, the person will not deposit madness for the survivor. They can be what? That is normal now. See, hello, am I competing? If normally, if somebody bites you, normally you should go for treatment now. Am I competing? If somebody bites you, you don't say, hey. Do you know what person is carrying in his mouth? But the one that if they bite you, you start running mad. It doesn't make sense to me. Physiologically, I'm just analyzing it physiologically. It makes no sense to me. I'm not communicating. So it really depends on what the person is passing through, what is inside that person, and what the person deposited when. Whatever you will experience depends on what the person deposited in that bite. That's the only explanation I had. That's the only explanation I can give. But not that once a man is a married man, you start running mad. It doesn't make sense to me. You know? So I will not, it makes no sense to me. So, normal physiology, I can't even, pathological, I can't even, the only thing I can know is that they depend on maybe their teeth, you don't even know where they put their mouth, what they have been eating, the jokes in their, you know now, they eat nonsense. It's just, you don't know what they ate before biting you, and it's in their mouth. Most of them are always in the dump area. You don't know what they've eaten since. The first thing that you go for work to tennis whatever, two of us, that one is there. Am I correct? And that one is normal. You that's normal to avoid any head because you are the positive, but not that the person want that you start running mad. All right, so we've not. Okay, you want to go? No, what? Let me just finish this. We almost with relevance of what psychology. Let's just conclude. So, psychology is essential in addressing human what disparity. Sorry, health what disparities. What are health disparities? There are significant differences in health what outcomes among different what population. So with this now, if you use cultural sensitive intervention, knowing fully that these people don't accept this, they accept this, you know how to take care of those people to be able to achieve the outcome you want. So you use cultural health psychologists use culturally sensitive interventions to help individuals from diverse backgrounds to adopt what healthy behaviors and manage chronic what diseases. Are you aware that there are some cultures that you don't even they are like surgery, you cannot open their nothing invasive. Hope you know you cannot open you cannot try it. It's against their what. Am I convinced? So what do you now do? You look for how to go about it to be able to achieve what you want to do. Huh? If there's nothing else you can do about it, they can do about it. And if it's for now tomorrow, they don't want to, and that thing must be done. They will sign for transfusion. They will sign. So if it happens, they will bear it. They must sign. Then if they don't want to sign, run. If they don't want to sign, that's a run now. You refer them and run. Yes. You cannot say that you got transmission at the same time you don't want to sign against wrong. You must do one. Even normally say in every surgery you must sign whether you are using whether there is transfusion or not. True of us. In every serious where you start having life maybe 50 or whatever percentage or give and take or life death situation, you must sign. Somebody must sign from the family that they should go, and anything happens there's no problem. You don't just wake up because you are a Christian, you just throw your knife and start to do nonsense. At the end, they will ask you who asked you to do it. Who told you to do it? Okay, now the next one is mental health. I think we've talked so much on this mental health.
Yes.
We've talked a lot on this mental health. We've talked a lot of things on this mental health. So psychology is very, very important in healthy mental state. Am I completing? Yes, it's very important. Mental health is the mother of, in fact, that is the mother of the entire aspect of your health. So it affects every aspect. Your mental health affects your physical health. It also affects your social health. Your mental health controls your social health and your physical health. Communicating? So psychology is very, very crucial in promoting mental health. Then mental health is essential for overall health and well-being. So because of that now, health psychologists use evidence-based intervention to help individuals manage their mental health conditions, such as depression and anxiety disorders. Anxiety what? Disorders, and depression what? Disorders. So generally, in conclusion, let's conclude this, the relevance of what? Health, psychology in healthcare, in health. Yes, psychology plays a vital role in health, and its relevance cannot what? Be over what? Stated. We cannot. So its contribution to health is multifaceted. There are many angles. You can discuss the importance of what? Psychology in what? Health. So in our next class, we'll start from developmental stages. We'll start from human developmental what? Stages. That one is another big area because we'll start from child.
That one, let's see.
Is it next year, next week? Which one?
Next year.
You don't want next week?
Exam.
Why? Simple exam. Ordinary common exam, you are afraid. Ordinary common exam, you are afraid. Waiting. Alright. What's your problem? What's your problem? Are you afraid? You're not with us in this class. You are your own class. Are you here with us? Okay, Revolution. Are you serious? I'll find out soon. Alright, so in our next class, whatever it will be, we'll start from stages of human what? Feel like you need to make noise in class too. Are you you make noise a lot in class. How? Is there any other way to make noise? You are human being. People are doing conversation. Study whatever we are doing in this class. Study whatever we are doing in this class. Whatever we are doing in this class.
That means it's only one topic. That is the only one topic. Yes. And this I are doing like this.
Study in class. Study whatever we are doing in class. You know, she wants to preach. I ask. You don't see your friend. You're serious. The material is in the group. Go and study. Study whatever we are doing in class. From the beginning of this class till today, study them. It's so BJ. Hello. Wait. I want to understand something. Are you afraid of theory?
We can never be afraid. We are just. We can never be afraid. Be afraid.
What's going on? Alright, in our next class we start from stages of human whatever it will be. Thank you very much for your attention. God bless you.
Thank you, sir.